Good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from our Dolph Simons Family Studio. We're delighted to be back with you again today. Another really terrific program and lineup. Besides Doc Hawk, we also have Secretary Lee Norman from KDHE, who's joining us by phone, and Alicia Morris, the Olathe, Kansas theater teacher who created a Google Doc to track COVID-19 school closures, quarantines, and/or deaths, and has made world news. Alicia, we're going to come to you in just a moment, but first, we want to check in with Chelsea Smith. Chelsea's been in our program before. She's with the Community Blood Center and has done a great job there helping to make sure we have a good enough blood supply for all the folks here in the Kansas City metropolitan area. Chelsea, thanks for being back with us today. And I know you're over at the Medical Education or Health Education building here at KU, and just want to say thank you for being here and thanks for helping organize that blood drive. How are things going this morning?
I think they're having audio problems.
Okay, still have some trouble. We'll come back to Chelsea in just a minute. So let's skip now to Alicia. Alicia, talk to us for just a moment. What's going on out there with Olathe High School, and what are you doing as a theater teacher creating spreadsheets? I don't think of the theater teachers as being, techno nerds like Hawkeye or something.
Well, surprisingly, I actually am more on the technical side of things as a theater teacher. There's really a whole world beyond just performing. And I really like organizing information and categorizing it. And so it just started as a personal interest project to really see what was going on in the world before we started our school. And I just couldn't find any of that information cataloged in one place. So I just started making it happen myself.
Yeah, that is amazing. Well, we'll come back to you in just a moment. But first, Hawkeye.
Yes.
How's it going? I caught you in a drink of coffee.
Yeah,
I'm trying to stay awake, brother.
we need our caffeine. We didn't really talk about caffeine.
We didn't talk about that yesterday with nutrition. We'll have to ask Tara to
Yeah.
come back and talk about caffeine, which I don't do, by the way.
Caffeine's
I'm hyper like this and have ADD, so more caffeine does not help me.
I think we're just kind of at a meh part right now. As far it's not real good, but it's not real bad either.
Okay.
So as of today, we are at 27 patients in the hospital who we're actively considering as active COVID rather than not recovered, but meeting our criteria for getting out of isolation. So of those 27 patients, 4 of them are in the ICU and 3 are on the vent. It should be noted that we still have 3 people on the ventilator who would otherwise we'd considered past that acute infection stage. So and then overall we have 27 in the hospital that have been here for a while now who are considered out of that acute stage as well. So
yeah.
Could be better, could be worse. We certainly want as least amount of patients in the hospital as possible, but it's better that we're not up in the 30s and 40s.
Hey, and so, right, but the total number is around 50 altogether, so that's still a high number.
Yeah.
Hey, a lot of excitement around that Abbott point of care testing, sort of point of care testing. It's on that little credit card size antigen testing, not antibody testing, not like the swab that hit the news the last couple of days. And then last night, maybe some concerns being raised about its real sensitivity and specificity. Yeah. Thoughts about that so far?
I think that is going to be the most important part moving forward. What is the actual sensitivity of this test? There has been a lot of thought and a major line of thinking that if we can test more frequently, then the absolute sensitivity doesn't have to be as good as PCR, because we know in general the molecular tests, the PCR tests, are more sensitive, meaning that it will pick up the disease if it is there. And you want something 95% or better, obviously 100% or better, but no test is 100%. The PCR tests tend to be very sensitive and will pick it up 97% of the time or more. These new antigen tests will seem to pick it up, 70 to 90% range, but people think, well, if it's not picking up, then that means you don't have a large amount of virus to pick up. So that's a good thing. So there are prevailing theories now is testing more frequently, even though the test sensitivity may not be good, but testing, say, every day, every other day, or every third day is probably still going to be better in controlling this pandemic. So if we can get testing out to the masses and make it accessible. And that way, as we've talked about now for the past week or two, if you're increasing your testing numbers, you will hopefully be decreasing your overall amount of percent positives, but overall getting a better picture for how that disease is looking and spreading in your community. So.
All right, well, that'll be great. So first of all, I want to say a shout out to my oldest daughter, Ilea, who is watching this morning from Chicago and just informed me that I need a haircut. Ilea, I think it's probably true. Tomorrow morning, 11:45, I'm going to see Tennyson. Thank goodness for that one. All right, now that we've covered that topic, Chelsea, you're over there at the Community Blood Blood Bank Drive over in the Health Education Building. How's it going so far?
It's going really well. We've got some donors on beds, but we also have a lot of empty beds, so we could use some more. But we had an awesome day yesterday. We saw 85 people here in this room collecting, spread out over the course of the entire day.
Of course.
But we brought home 85 units of blood, so it was a great day, and we're hoping to replicate that again today.
Oh, man, I sure hope so. And, with the great work our blood bank does is probably not, the Community Blood Center does, is probably not talked about enough. And the great work from all of our donors that are out there, thank you so much. They're coming to do that. The Health Education Building is really safe. You guys have got this scripted. You've got it down. Either your third or fourth time since the pandemic of being there, and we totally appreciate it. So, Chelsea, how's the blood supply doing overall for the Kansas City?
It's still a lot lower than what we like. Since the onset of the pandemic, we have not yet hit our 7-day supply, which that's our sweet spot, like I've said over and over. But we're sitting about a 3.5 to 4-day supply right now, so it's okay. We're not comfortable with it. We want that 7-day supply. That's our goal. But I've said this a few times. There's a lot of new normals that we're all dealing with, in this post-COVID world. But a blood shortage can't be a new normal. It just can't. So, we're really hoping, donors hear this message. They're going to come into drives like this one or come into our donor centers and help us get back up to that 7-day supply so we can comfortably supply all of our hospitals.
All right, well, good luck, and thanks again for being there, and we are so appreciative of the great work that you do, the Community Blood Center does, and all of those who donate blood. And I kept trying to say fundraiser, but the truth is you do raise fund because you allow people to go out and survive and thrive, especially during the times when they're most critically ill. So thank you for that great work.
Absolutely.
Secretary Norman, are you out there?
I am indeed. Good morning, Dr. Stites.
Good morning again, Lee Norman. And hey, you've been in the news a lot lately.
Yeah, I don't seem to be able to avoid controversy. It's amazing how politicized the COVID-19 has become, and especially mask wearing and policy. But it is what it is.
Like in this show, it sounds great.
I try to read every day the New York Times and the Wall Street Journal. I figure that gets a pretty good balance. You were featured in an editorial there, man.
Yeah, front page. It's actually an old story and one that's been retold wrongly, I might add, about a graph that showed the masking counties and the unmasking counties, the ones that have mandates. And I think as much as anything, people didn't like what I had to say, which is masks work. And so there's been a certain faction out there that wants to discredit that. And I just take the licks and keep on going. And I'll show the data again in a couple of weeks. I'll display it a little different, so that the people can't nitpick on the graph itself. But nobody argues with the data and with the conclusions from it. They just don't like it.
Yeah, it's amazing to me because it's clear that masks work. I don't know why that can even possibly be controversial. Otherwise, we wouldn't wear masks in the operating room, and people would get a lot sicker if we didn't do that. And wounds would be much more infected as the secretions and what we breathe out carries bacteria and fungus and all sorts of stuff, and that will get into a patient's wounds. I mean, there's just really no question about it, and it's just odd to me. We tried to show this back in the freezer. I think we're back in the freezer again next week to try and create yet another angle to show people what happens to your breath cloud when you don't have a mask on and what happens when you do, because the difference is so stark. I mean, it's just so true. I have a hard time understanding why anybody wants to contest that, I guess. So, so Lee, a little bit, just a couple quick questions. So, Kansas has got a new thing that I think had gone up on KDHA's side about limiting sizes. Or if you go and you're at a mass gathering of 500 or more, you have to quarantine for 2 weeks. Do I have that right?
Yeah, that's right. It's, all along we've been doing it for other states and other countries, but because Kansas is so high, almost every place other than Kansas has lower numbers than we do. So those have peeled away. But mass gatherings are still a problem. 500, whether in state or out of state, mostly gets at the things that you know about, which are unmitigated gatherings. That mean, without social distancing and mask wearing and the like, because that's where we're seeing cases crop up. And we're seeing not just cases here and there, we're seeing cases in the hundreds crop up that emanate from mass gatherings, and not a surprise. So we're trying to do what we can. I think 500 is too high, but that's where we wound up.
Yeah, I think Dr. Birx, who leads the White House task force on the coronavirus, said the number should be 10 2 weeks ago. She was here, and we met with her. What does this mean for Kansans who want to go to a KU or K-State football game or to a Chiefs game or to the sporting game this week?
Well, if they can't socially distance, then they should be quarantined upon coming back. If they can't be distanced and do the other barrier methods to keep from getting infected. I mean, we just shouldn't relent on that, because we just know they're going to come back and spread more virus.
No,
so
absolutely.
we need to spread out and wear masks.
Yeah, the infection control part of that is clearly true. So if somebody has a mask at a game and is still sitting far apart, would they have to quarantine, or is it only people who can't achieve that?
Who can't wear where those anti-contagion measures cannot be mitigated.
Got it. All right. Well, that totally makes sense.
Or are chosen to not be mitigated, rather like in the Rose Garden last night.
Yeah, that's tough. How's school reopening? How are those going?
Better in the K through 12 than it is in colleges and universities. We've already seen, and I know you know this, Steve, hundreds of cases cropping up around the state in various colleges, community colleges, settings, and a lot of those weren't locally transmitted. A lot of them came in from their local communities. It's a little too early to call on the K through 12 side, but it appears to be a little bit better. I'll be really interested to watch that database. I mean, we know where the cases are because they come and get reported to us. We're going to start displaying those data in schools and universities to give a little bit more granularity, so you can tell which schools, which universities those are in.
Yeah, it'll be interesting to see that data, and I think it'll be helpful. It'll be a little funny. We have to make sure that, because some people are doing a lot of testing, some people not so much, but of course that's been the story of the entire pandemic, hasn't it?
Right, that's true.
All right, so Alicia, tell us how you came up with the idea of a database, and how's it going, and tell us about what's on it.
Well, I was really curious. Kind of beginning of August, I was seeing all these articles come out about, especially Georgia and the North Paulding school with the viral photo, and I saw all these articles stating all these cases that were happening as schools opened. So I started getting curious and doing research, and I just couldn't find all of that information cataloged into one place. And what was even more concerning too was that states were outright saying that they were not going to be tracking what was happening in K through 12 schools, which as a teacher I was a little worried about, because I kind of want to know what I'm going into. And so I just started putting stuff into a Google Sheet, and I initially shared it with some colleagues, and they encouraged me to share it with other teachers across the country. And so I did, and it kind of went viral from there, and that was not what I was expecting, but it became a crowdsource really quickly. I was accepting articles from people. I had over 65 people helping me input information into the spreadsheet. And actually right now I am transferring over the operations to the National Education Association. So my responsibilities are almost finished with that spreadsheet, and I'm very thankful because I'm back to teacher training and getting ready for the school year.
All right. Wow. And so that's a big deal. And do you think it's helped inform teachers about what they needed to do, or classrooms or schools about their plans? How has that information been used?
I definitely think it's been a good informant for many districts, especially Board of Education. I shared it with the Olathe Board of Education, and they said that they did look at the spreadsheet, and it did help them make some informed decisions as returning to school. I'm not sure if the rest of the country's districts have done that, but I would like to think that, they've taken a look at it and seen what can happen.
Pardon me, I had to sneeze. I've been sneezing to my elbow, however.
Good job.
All right. Well, that sounds like a massive undertaking. It had to have taken hours and hours to do. And so thanks again for the great work that you've done on that. Jill, let's see what questions are out there, because I bet they're out there. First from media.
Yeah, okay.
All right.
All right. So first thing we want to say is Melissa wants to tell Dr. Norman, thank you for everything. All of us are thinking that what you're doing is for political reasons. So.
I know Lee pretty well. Actually, I know Lee really well, and I would tell you that, well, he has some strong political beliefs. He does not act on a political reason. I think he's out there because he thinks it's the right thing to do. I don't think he needed to take the job as secretary at KDHE. I think he felt like he had something he could contribute. I mean, he served in the armed forces. He's been to Iran and Iraq, the Middle East, and I think the guy really has a pretty good heart. So I'm not just trying to butter you up, Norman. I'm just trying to tell it the way it is.
Yeah, that's fine. Thank you. Sometimes I wonder about my sanity for having taken it, but
I didn't say that now, did I?
We didn't say you weren't insane.
I didn't say brain.
Right.
All right, Jill.
Debbie Ann wants to know if there have been any clusters specifically in dental or orthodontic offices.
Lee, how are we doing with dentists and orthodontics?
None.
You know, it's proof that PPE works.
Yeah.
That and the whole story behind the we keep coming back to this. The two hairdressers that were positive, and everybody had a mask on, and nobody got it. And then you hear dental offices are not doing that. Hospitals, we're not seeing the spread in hospitals. Why are we not seeing a spread in hospitals? Because everybody's got a mask on.
Yeah.
I mean, you know, PPE works. I am astonished that people still want to fight that point. Now, I understand if somebody says, well, we really don't have much virus out here and I don't want to do it. Okay, you know, fine. But the virus is coming to you because now it's everywhere. But the idea that masks don't work, it just astonishes me that we're still fighting that, Dana.
Yeah, absolutely. You know, we know that a lot of the societies have taken up and put out measures and protocols and systems to their member organizations and their member clients. We know that the American Dental Association has done that, has been very proactive. So we know that in general, the dentists themselves, for protection of themselves, for their patients and their workers, have really followed those things to a T and even gone over and above to mitigate all of that spread within their office buildings. You know, I have a friend, Jared Williams, who's a dentist, and you know, early on was texting me weekly about, is this the right thing to do? Is this the right thing to do? So we know that, you know, eye doctors and dentists are really taking all of those measures to the T, doing it so they reduce the risk of spread to themselves, to their employees, and to their patients.
We do have a dentist on Monday. That's our topic, by the way.
That'll be awesome.
Yeah. So people that have a lot of dental questions have it ready for
no,
Monday.
Dr. Corin Tager is the head of plastic surgery here. That's and our dental team reports up to them. And so one of our dentists, and Dr. Corin Tager, will be here.
Donna wants to know about the spreadsheet that Alicia has created. How are you getting the data? How is it different from the data being collected by the health department? And is there any connection? How is it useful?
All right. Well, and it's a crowdsourced data, so people are putting in what they know, I think.
Yeah. I've actually I initially started Google searching just random articles from local news sites in order to get the data to put into the spreadsheet. And as far as like what's different than the Department of Health, as far as I know, the Department of Health doesn't really break it down by what's happening in the K through 12 buildings, especially. And so I think that people want to know, well, like, what are the buildings in my area, the other schools around me, what's happening there, or what's happening in other states with schools that are similar sizes to me. And I think that it's just really helpful to see what's out there. But unfortunately, we're not really getting the full picture because there are so many cases in schools that are not being covered in the news for whatever reason, or trying to be kept on the down low from the district for privacy reasons, of course. But I also think that this is kind of important that teachers and community members and students who are going into school, I think they need to be fully informed of the potential risk that they might face.
Yeah, I think that's right. You know, one of the things we've emphasized on this program is that, and we've gotten, is that it's safe to go back to schools. And our answer is always the same one. This is largely a private and personal decision, as well that's based upon the health of your family, the health of your kids. And I mean, but that by saying that, both mentally and physically, the financial health, I mean, if both parents have to work, I mean, those are all real world issues But part of making that determination is knowing what's going on inside your school and how much of a risk it is. And the only way you can do that is with good data. And I think that, and then, how well people wear masks and what the culture is inside that school.
Yeah.
Those are the things that allow, I think, individual parents to make decisions about what is the risk to their family about going back to school. And I think that's one of the great things about your document. I got to spend some time going around it and looking at it, and I thought, if I was a parent, that's the kind of information I would want to know about going back to school. So thank you for doing that.
Cindy wants to know if Alicia has had, what kind of reaction she's had from the community.
All right, how are people treating you out there, Alicia?
Actually, pretty well. I was thinking I would get a lot of pushback, but I really haven't seen that much. Most of the time, people are just pretty thankful to see this information. And I made it pretty clear from the very beginning that I wasn't trying to take a partisan side on this. It was just like, hey, here's public information. Why don't I put it all in one place for you just to be helpful? And so I've never said like what we should do because of it. I've just talked about what I've noticed. And I'm very thankful I'm not in a position that is forced to make decisions regarding school openings. So I'm just, my goal is to make it easier for them to find all of the information that they may need to collect.
Yeah, and I think that's right. That's kind of, we try to say to take the same stance on this program.
Yep.
We're not going to be political, but we are going to try and tell you the truth as best that we know it at any given time with science. And I think that's exactly what you're doing, putting the data out there, letting people make their own decisions. I think that's the right thing to do.
All right, Emily wants to know if the doctors could reconcile that in the beginning everyone was told to stay home. Now we're allowed to go out and we're even encouraged to go and get a test. And for her that seems confusing.
Yeah. We're building the airplane while we fly it.
Yeah.
And I think the truth is that when you don't know very much about something and you're trying to make informed judgments, your judgments may not be informed. The more you get information about it, the more you learn, you can react to it. So at the very beginning, if you'll remember, we had this whole thing about wiping down surfaces and how long the surface had to be clean and blah, blah, blah. And now we know that really the most important thing is masking and social distancing. Surfaces can spread coronavirus, but much less of an emphasis for us. We've learned a lot more about that. We've also learned that with masks and maintaining social distancing, your risks drop pretty dramatically. There's been great data that's looked at that. And so I think at this point what we can safely say, as best we know it, as the airplane is currently constructed, that it is very safe to go out and go to be tested to see if you have COVID, to go to your dentist, to come to the hospital, because we've got data that says that's safe. But it's safe. Why is it safe? This is really important. Why is there not spread in dental offices? Why is there not spread at hairdressers? Why is there not spread in a hospital? The reason is very clear. It's because there's mask wearing and social distancing. That's what stops the spread. Now let's flip this stage for just a minute. Douglas County just quarantined 10 fraternities and sororities over in Lawrence.
Yeah.
Why is that? Not enough PPE, not enough social distancing. And so now there are hot spots. And I think, the story is the same one. When we behave, we're good. When we don't behave, things go badly, Lee Norman.
Yeah, they do. To Alyssa's point earlier, by the way, we are going to break out schools by name so that people have access to that on our website. Ditto that for universities by name. An interesting problem, I should say, about universities, for example, fraternity and sorority houses, that it's off-campus housing. We will associate a fraternity or sorority house with the university members. But, interesting question is that any different than an apartment building that houses students across the street, that is not a university affiliated? So it's, no matter what you do with the data, it's hard to associate everything absolutely crystal clear. But we're going to try to put as much out there as we can to inform parents and policymakers and the like.
Yeah, and the reality is it keeps coming back to the same thing. Where you have congregations, whether it's in a party or it's at a fraternity or it's a game or it's a political rally, it doesn't really matter.
Right.
If people don't wear masks, they're going to get in trouble. And if they do wear a mask and try to respect social distancing, they're probably going to be okay. And that really helps answer that listener's question about what she asked. So, Jill, next question.
Carrie wants to know if Dr. Norman can help her understand the differences between the state COVID dashboard and she says the Johnson County dashboard. There's a big discrepancy. She says a big discrepancy between the percent positivity.
Dr. Norman?
Well, a couple of things. One, it's a matter of timing because our data feed comes from both the test results from the laboratories that have electronic data transfer and from the counties themselves. So counties that do the case investigation and contact tracing, they actually have the information before the state does. Eventually it syncs up. There is one difference in definition, and one of us measures the positive case at the time that it is the test is run, and one of us measures it from the time the people began with symptoms. And for those that are asymptomatic, that would be the time that the test was done. So there's a little bit difference in the definition, but usually it's about timing. We're working with Johnson County and Dr. Ariel Lemaster to sync it up so that it takes away the confusion. Overall, the differences are pretty small as a percent, but we want to have it be of people have confidence in the data.
And Dr. Norman, just one thing to point out is that public health has been underfunded in the United States for a long time, and it doesn't, I'm not going to say it's not necessarily a Republican or Democrat thing, that's just an is thing. And I think this pandemic has laid bare some of those inconsistencies and challenges to counties and states because they didn't have the infrastructure in place. Comment on that.
Yeah, I did a presentation that was somewhat prophecy early in the year to the legislature that pointed out that we are in the bottom third in a per capita basis of funding of public health. In Kansas, the state funding for public health is $60 per person per year. Just to put that in perspective, people spend $90 on Super Bowl Sunday just buying food and beverage and merchandise. So we are at the bottom of the heap in terms of public health funding. And curiously, now we're asked to do budget cuts because of the fact that with as much unemployment, there's less state revenue coming in. And so we're looking to see where can we economize. And the federal dollars coming in through COVID relief have been helpful, but they've not been life-saving yet.
Can you squeeze in one quick question before you go? Because I know you got to fly.
Yeah.
All right. They want to know, when you test, is it one test recorded per individual, or people that are multiply tested counted multiple times?
We count them one time. And the reason is, and this is a hot issue because the naysayers that believe that COVID-19 doesn't exist, they'll say if you test somebody 3 times and then the 4th time you get a positive, or the other way around, test them 3 times until they're negative, that represents 4 or 5 tests. We do not do that way. We do it per individual, unless it's 90 days or greater out.
All right. Secretary Norman, I know you have to run. It's always a pleasure to have you on the program. Appreciate your hard work, your friendship, and all your advice. Good luck out there.
Okay, and thanks. And Dana Hawkinson, I just sent you an email today. There's an interesting question that I want you to answer, and I know you'll want to comment on it next week. I'm just teasing everybody. It's a fascinating discussion. So good luck with that.
We'll make sure he comes. He fesses up about it, Lee. Not to worry.
Okay. Bye, guys.
All right. Thank you.
Bye.
Alicia.
Bye-bye.
This has got to be kind of a relief to you to give this over to the NEA, the National Education Association, to help manage that database. Are you going to have any role in it going forward?
I am continuing to submit my own cases and articles that I find pop up. I've sort of taken Kansas and Missouri as my responsibility to search out those articles and report them. And so I'm very thankful that beyond that, I don't have any more responsibilities because it was coming way too much. I was getting over 600 article submissions a day, and I just couldn't keep up by myself. And so I'm glad that they can take that on.
You know, I think the mere fact that you got that much, it just shows how much people really want to be in touch with the real data and the real truth. I think that's great. That's exactly what we need to continue to try and provide. Jill?
Well, and people are asking how confident she feels about the data since it's self-reported.
Right. How confident are folks in the data? Or are you in the data?
Well, most of the data is supported with an article link. So as long as we I guess, trust that the local news article has done their fact checking, then we can be fairly confident with those cases. There are a number of cases that have been reported to me that I consider unverified because they are not supplemented with either a link straight from the district website or a news article link. And so those are conjecture, and you got to take those with a grain of salt. And I know that the spreadsheet is not error-free because it is a crowdsourced effort done by multiple people on input. So of course we're going to make errors, but at least it gives you a scope of an idea of what's happening out there.
Yeah, that's exactly right. And I think that's what has attracted so many people to it. I think you were featured in the Washington Post. Is that right? Was that where that article was? I'm trying to remember.
There have been several, and I think I was on NPR this morning, too.
Okay. Well,
I've just been out there.
Yeah, well, it's such good work. Okay, Jill.
Okay, so we have a couple of kids' questions. One comes from Carrie. She said, my 14-year-old daughter was diagnosed on Monday. She's starting to feel better, but continues with the loss of taste and smell. And she wants you to tell her, how long is that going to last?
Oh, gosh.
Okay, Dana.
I think that's individual. You know, we do have a fairly good study from Italy looking at people who had mild or moderate disease who continue to have symptoms up to 60 days out and probably longer than that. So I think it really depends on the individual. We know you can have symptoms, whether that's just fatigue, being tired, whether that's some shortness of breath or cough, whether that's loss of taste or smell, that can probably last for several weeks. I think that's individual. But certainly, you know, seeing it maybe 4 weeks later or 5 or 6 weeks later, don't be surprised. It should come back slowly. But again, don't be surprised if you continue to have symptoms after the acute infection.
Yeah, and I think that that's right. And it should, again, come as no surprise because when you get sick, remember how it takes a few weeks to recover? And coronavirus, you get a common cold, and it takes weeks, you know, sometimes to get your nose cleared out, to get the cough cleared out and all that. It'd take 3 or 4 weeks, 6 weeks. And so I wouldn't be surprised that people are going to be sick for a while.
And Meredith has a question. She said earlier in the week you talked about 3 to 5 year olds kind of recommendations, pros and cons about going to daycare. She's curious about younger, newborns, infants. What's your thoughts on that and advice for parents?
I think our first thought is we need to get our Children's Mercy colleagues and Steve Lauer back on this program.
Yeah, you know, I was just reading an article this morning before that, and they looked at I think it was a BMJ article, a British journal, and they looked at children in the hospital, and certainly they had a very small percentage, and that's what we've seen throughout this, is that children are affected much less than the adults. So certainly for masking, things of that nature, it's not really recommended that they wear it if they're 2 years or under, if they have other developmental delays or special needs, not wear masks. You know, again, certainly I think in your household, you need to make sure that your culture and the people that can wear the mask and do the distancing, do the hand hygiene, that is done appropriately. That can then filter down to the little kids. As far as daycares, it looks like daycares are safe if they are taking those non-pharmaceutical intervention, those NPI. So that's the distancing, that's the masking by the adults and the other children or the other people in that daycare that can wear the mask, things of that nature. Having as much adequate hand sanitizing or hand washing as you can in that setting. And those showed that there was very small spread in daycares. I think that was published in daycares in Georgia on one of the CDC publications. But if you do those things, certainly the children, for the most part, are going to be safe if they get the infection, and that's going to reduce spread to other members in the household, especially those that may be in the vulnerable populations.
And then we have a question from Patty who wants to know, the COVID patients that we talk about in the morning, she's curious, are there other ones that present in the emergency department or doctor's offices that go on home, and do we count those? She just wants to know.
Yeah, we do not count those in our numbers. We only count the patients that are inpatient. And again, inpatient may be they are admitted for COVID symptoms. That may mean they come for something entirely different. But since we are screening all of our inpatient admissions, we screen those people, and if they're positive, they are counted. We also are screening all of our perioperative or preoperative patients. So if it's any one of that category and they're in the hospital, we count them. We do not count the outpatients that come through the ED and then go home, or that are tested, say, in the drive-through clinic and then go home.
Yeah, so you have to be admitted either under an observation status or full admission status to be counted as one of our inpatients.
Stacy wants to know, public schools are telling us they do not social distance, which is why the kids need to wear masks. Don't you need to do both?
Yeah. Yep, absolutely. You need a combination of both. Certainly we know that de-densifying and reducing the amount of people, and thereby also being able to increase the distance between students and faculty, is going to be of great importance, as is masking. It's not one or the other. To have the best effect at reduction of risk for infection, you're going to need both of those things in addition to the hand hygiene as well.
Donna has a question for Alicia. She said she wants you to clarify what cases are happening in KC Metro schools if schools haven't started yet.
It's a great question.
A lot of cases I've seen are related to student athletes. I know Blue Valley West last week announced that their whole football team was quarantined because of 3 positive cases. Bishop Miege just announced several cases that they had, and I think Blue Springs as well. So there's plenty of cases happening across the KC Metro area through those student athlete programs. And, for the most part, I think those athlete programs have done a fairly good job of mitigating the spread by canceling practices once they've pinpointed a case. It's just a little scary because it's only going to get a little bit more widespread once we actually open up and have kids in the building. And the social distancing is not going to be possible in our buildings from what I've seen.
So what are some of the measures being taken place in Olathe, Alicia, to help try and make it safer?
So we are required to have masks on unless social distancing is possible, which is interesting to hear you say just now that both should be utilized. It's just become abundantly clear that doing the 6-foot distance is not going to be a possibility. So they've told us that 3-foot distance is optimal or is recommended, and then 6 foot is optimal or ideal. And, I think a lot of us teachers are trying to wrap our heads around how we're going to fit 28 kids into a small classroom and still have a social distance and math. I don't know how.
Yeah, I think that is going to be tough. And I think that's the toughness is why, again, Danny, you really got to wear a mask as well as that. I know I'm not sure what recommendations are out in regard to that at Olathe, but I know that the medical recommendation would be wear a mask and socially distance. There's good data that shows that the combination of the two is much better than either one alone.
Yeah, I think a lot of the consternation and problem comes from on the CDC website. They said, if you are distancing more than 6 feet, then you consider a mask. I think we are really getting into the letter of the law. And what we really need to do is promote and endorse the spirit of the law. What is the spirit of the law? The spirit of the law is that less dense population or more distance between people is really going to be more effective at reducing the spread of the disease. That, coupled with mask use for both parties, is going to decrease the spread of the disease. That's what the spirit, that's the large, broad concept. And whether you're separated by 6 feet, we regularly have meetings where we are separated by 6, 8, 10 feet, but we are always wearing masks in the meetings.
Yep.
Because this goes to not only the children and the teachers in the classroom or the children with the counselors, this goes to the adults and the staff and the teachers that are meeting. Just because you're 6 feet away doesn't negate really the need to wear a mask. So because, I do have a friend who's a high school teacher. When all the teachers went back a week or two before the kids, 3 teachers came positive. So that culture with the adults in the school or the administration has to change as well. And really the masking and as far apart as you can be is going to be the broad concept that you need to understand. It's not just, if you're 6 feet away, just consider a mask. If you're indoors, if you're 6, 8 feet away, you still need to be wearing masks. And that is what is going to protect you and the families that the children go home to and the rest of your staff as much as possible.
One more question?
One more question.
Betsy has one that she said she read an article that COVID or the virus can be the virus can be transferred through bathroom piping in buildings, and she wants to know if that's true. KU was doing this, or somebody was.
Well, you can survey. You can look at bathroom water to see how much COVID is in the sewage, and actually that can be one of the first things because it can end up in your stool, and therefore you can find it. That can be an early sign that you got somebody in the building that is positive if you can sample that. I don't know what the practical implications of it are,
Yeah.
Dana.
No, I agree. We have been able to sample or detect virus in different secretions, including feces and stools. So we know there's a lot of other stuff in the bathroom that are bad too. But in general, I don't believe that they've really been able to culture infectious or replication competent virus from stool. That is a theoretical concern, especially in things like daycares. Can you have fecal oral transmission of the disease, such as other GI illnesses? But really that has not been shown at this point in time. So we can detect the RNA in stools. We haven't really found any clusters, and they haven't really been able to find any significant culturable virus from the stool. So it doesn't seem as if it's a big part. But yes, you can detect it in stool.
Yep. Alicia, final thoughts from the day. And again, thanks for all your great work.
Yeah, I would just say continue to have parents try to be fully informed before they send their kids to school, and same with the district leaders who are making those decisions. And local news is really important, so support your local news and get them to write some articles about the cases going on in your area.
All right. Stay
And thank
safe
you for having me on today. Yeah, thank you so
for
much.
being on, and stay safe out there. Chelsea, we didn't have as many blood bank questions today, but let me ask you one. Have people been safe giving blood? Oh, she can't hear us. No, don't tell her. Say it's not so. Chelsea, I'll come back to you in just a second. Dana, final thoughts from today.
Yeah. So a lot of points. So first of all, about the testing. Our testing has changed. There was a question about that. We would certainly, again, like to be able to test as many people as possible, as frequently as possible. There has been problems with access and the materials to do the testing. Hopefully, as we talked about with these antigen tests, these very quick turnaround time antigen tests, we'll be able to roll those tests out and find the correct method in which to do it to get as many people tested
as soon as we're
frequently as
convinced
possible.
they're really good.
Correct.
We're not completely convinced
Yeah.
yet.
The other thing is, we talked about these non-pharmaceutical intervention, these NPIs. We talked about surfaces. We don't think surfaces are as much of a problem, but that is also in the setting of we have really endorsed hand hygiene. So if you're touching these high-touch surfaces and the virus is on the surface, it's not going to go through your hands. But if you're doing adequate hand hygiene, that's going to keep you safe. And the last thing is we've really tried to tell you and change the culture of just thinking that the virus is out there. And it's not because of fear, but it's because of knowledge. And if you can start to understand that, change the culture within your family, within your household, within wherever you're working, whether that's a school or an office building, and you do these non-pharmaceutical interventions and understand the broad concepts of masking of both parties. We know masking works. We saw that the two hairdressers in Springfield who had COVID-19, but both parties were wearing a mask, the hairdressers and the clients, and out of 140 clients, they didn't find any obvious exchange of the virus. So we know the masking works even in those small settings. But that doesn't take away the need for more space is better, more distance is better, and both parties wearing the masks are better, and that is what is going to reduce the chance of you getting it and maybe you bringing it to your household or you bringing it to your other coworkers, teachers, administrators, things of that nature. So those are the broad concepts, and it's not the letter of the law. Well, I'm 6 feet, so I don't need to wear a mask. It's that broad concept of distance and masking, reducing the amount of or the chance that you can get the virus.
Yeah. All right. Well, thanks to all of our listening audience today for joining us. Chelsea, we didn't get to hear from at the end, but just to say what great work she and the Community Blood Bank do. Thank you, Chelsea, for being on the program today, and good luck on the blood drive. The blood drive is at the Health Education Building here at KU. You can go to believe, I think it's savealife.org. If you go to the Community Blood Bank, you'll find the link to that, and it's just incredibly important. We had 85 yesterday. Let's see how many we can get to today. So thank you all so much. And Chelsea, I don't know if you can hear me now or we can hear you, but thank you so much for the great work that you and the blood bank doing. Alicia, thank you for the great work you've done, and man, I bet that is a weight off your shoulders to see that go to the NEA. To our listening audience out there today, a couple of important points. On Monday, we have a dentist who's going to be with us, Dr. Maria Adelman, and then Dr. Richard Korentager, because we know that you're going to want to know how safe it is and what are the dental office doing to keep keep you safe. We heard Lee Norman say earlier today, not any cases of transmission known yet in Kansas from the dental office or an orthodontics office. That's great news. We'll address that topic head on come Monday. Also, we are always asking, send us your pictures of you wearing masks and show us also how you're staying safe. My goodness. I'm really glad it's Friday. Staying safe. I'm glad it's a Friday is what I'm glad about, and I think our listening audience probably is as well. COVID is out there, right? And we had a little fun with it earlier this week with cows. I'm going to mention again, COVID weariness syndrome. We also know that there's been a lot of controversy around masks. The best way to treat cows is to wear a mask. And the best way to stay safe is to do the things that pillars of infection control that follow you everywhere you go. That way you can keep the coronavirus at bay. That's how we stay safe. And that's how we take care of each other. That's how we take care of those who we love. Hey, we have a final video here today. Take a look at this because I think it will tell us just how important it is to wear a mask no matter how old or young you are. So until we see you on Monday, stay safe out there and remember there's still no place at home like home.
Today we have Ariel Brown from Wichita. Start when something first popped up that made you concerned. Would you tell us about that?
Okay, so I had been around a small group. It wasn't a group of people, but just a small, tiny group. And I got in a call almost 3 days later that someone had a sore throat and they were going to get checked out. But 5 days later, I got a call that in fact it was COVID.
Okay, and then did you develop symptoms anywhere along that way there?
I'll say within 3 days. I had a day where I was just kind of, minding my business. I was working from home during my quarantine, but I got a massive headache and I got really exhausted. Like, it just felt like I was depleted. And I laid down to take a nap, and that nap ended up being like a good 4-hour nap, which is something I don't do, especially in the middle of the day. So I knew it was kind of abnormal. I just felt like I didn't have anything, like no energy.
Any other learned lessons that you've picked up during this period of time?
Listen to your frontline friends, but also from me being initially asymptomatic, I think there's a lot of people walking around that know they've been in huge crowds and know they haven't been tested and haven't given any of this any thought. Because what I'm noticing is that Wichita as a whole isn't necessarily taking this as serious as they should. And also that you can get it from people that you're friends with or your business partners or your family members. People think that familiarity for some reason makes you immune to catching it. And it's this thing you get at Walmart or if you go here, but you can easily get exposed. So I think it's just buckling down and just bite the bullet for now and just sit down somewhere, sit down for a minute. If you don't have to go to this, that, and the third, or if you're not to meet with the same people. And I think that's why it's spreading is people are simply not taking it seriously because they feel fine.